Okay, welcome everyone. Welcome. I am very excited today to have Dr. Regina Khaimova with us. She is a physical therapist. Welcome. I am very excited today to have Dr. Regina Khaimova with us. She's a physical therapist. Okay, sorry, we were getting the kickback from Facebook. Just wanted to make sure it was working, which it is. Okay. So today we have a very interesting topic, which apparently is very popular from the amount of people that said they would join us today. And hopefully people will hop on soon. But we're going to get started here. If you're joining us live, please comment #live in the comments so I know you're here with us. And if you're watching the replay, please comment #replay so that I know that you're watching the replay. So welcome everyone. And you'll tell us where you're from. If you're watching this live now, just tell us where you're from so I know that you are live with us, and I'm sure we have people on with us from all over the world. So thank you for joining us. So today's topic is incontinence in older adults, and we're going to talk about the what, where, how, and what to do about it. I think a lot of people suffer from this and really don't know what to do. It's a very annoying and common problem that people don't like to talk about. It's embarrassing, but we know that it happens. And let's figure out what we can do about it to make our lives have a little more quality of life. You know, everything when we're talking about the brain or the heart or the incontinence, whatever we're talking about, the goal is always to have a better quality of life so we can age more happily and healthfully for many, many years. So lots of issues come up and we try to address them and deal with them to the best of our ability. So hopefully you will learn something new today, and this will give you some practical tips and guidance of how to deal with this issue of incontinence. Okay, Dr. Regina, it has a lot of experience. She works with different age populations and different parts of the physical therapy world. So tell us a little bit about your background and your experience with this, and then you can get started. Welcome.
Thank you, Rena, for having me again for this presentation. I'm really happy to be here and really educate and present this topic today. I think it's very important. And a couple of years ago, within my career, I started specializing in women's health. And this is the first topic that I learned and started helping women with. So, you know, and also specializing in pediatrics, which we also toilet train kids as well. So, but just focusing on today's topic, which is incontinence and what it is, why it happens, and how we want to, you know, we should deal with it. I'm gonna share my screen here so that everyone can follow. And slideshow. So, let's see. So what is the urinary incontinence? It's basically, just in basic terms, it's a loss of bladder control. It's a condition with involuntary loss of urine. It's very common and more common in women than men, and even more common in women in older population. You know, it is an embarrassing issue, which not many would like to really speak up about it. And I really doing a lot of outreach there that women should speak out, because although it's a common problem, it is a very treatable problem, and there are solutions and really hope for, you know, getting rid of it. The severity ranges from leaking occasionally with coughing, sneezing, laughing, or lifting, to having a really like an urge, a strong urge to go and really women just not making it to the bathroom to that point. All right, next slide. Okay, causes. There are a lot of causes. I put them all here, but just for the purpose of this this presentation, we're gonna concentrate on elderly population, but it does happen. It's caused by, you know, muscles and the nerves that are affected, that's supposed to serve as for holding and passing the urine. So they're doing two jobs. And a lot of women suffer from urinary incontinence when they're pregnant, after childbirth. I'm not going to go to detail here right now, but those are the two very common ones as well. Menopause is, some women have bladder control problems after they stop having their period. So, the low estrogen production causes to weaken the urethral tissue. So, weakening the muscle and all the whole pelvic floor as well. So that's very important to have the strengthening. Just like with age, our muscles in the body atrophy, we lose muscle mass. So too with the bladder. Bladder is composed of muscles. Same thing happens here, that we lose that strength and the muscle ability to hold and pass the urine. Constipation, those that have a chronic constipation, whenever we strain to really pass the bowels, we also develop that incontinence. And that's something that we do treat as well, the constipation along with the urinary incontinence. So, it's like a vicious cycle. One causes the other thing. Now, speaking of vicious cycle, medicine, it also can cause some side effects like water pills. You can have that side effect of urinary incontinence from the water pill. Sometimes the hormone replacement therapy, those medications cause the incontinence. And also, some medicine cause the constipation, which then leads to urinary incontinence. So that's like a really nice, so to speak, a vicious cycle, which is not pleasant. And the two other things, caffeine and alcohol, who would think, right? Drinking caffeine can cause the bladder to fill up quickly, and therefore we're not able to make it to the bathroom quick enough in time. So those are not as good to take, to drink before bedtime. So make sure we don't do that. So some other causes could be infection, nerve damage, that, the nerves that supply the bladder, that can cause either trauma or the disease, such as like diabetes, multiple sclerosis. Also, the Parkinson's disease can also have that cause to have the urinary incontinence. And another cause is excess weight. It's also known to have, when we're overweight, there's pressure on the bladder, and therefore it causes the incontinence and makes it worse the more we add the weight.
Regina, can I ask a question that's just coming up for me? Maybe other people are thinking also. You mentioned a few times women. Is this also a problem for men?
Yes, as I mentioned earlier, it is affecting men as well, but not as much. And I'm going to go through research right now, specifying as well. There are some numbers as well, but not as much men are affected than women. And like I mentioned before, it's affecting women more than men, and then even more so women of older population are more affected, just because of the fact that the menopause, there's a lot less production of estrogen, and also just in general, as we age, we have the muscle mass loss as well. So the weakness of the bladder muscles cause that incontinence as well. So some research, the effect of age on lower urinary tract function. So they found that 85 community dwelling ambulatory female volunteers completed the exams, and it showed that the closure pressure, the muscle that's supposed to contract while holding the urine, and the flow rate passing the urine declined significantly with age. And that was female volunteers that went through the study. Okay, so there are also just some statistics, who is the most affected. 25% of young women, and then it increases to 44 to 57% in middle-aged women, postmenopausal women, and then 75% of older women in nursing homes. 7% in middle-aged women.
Sorry, I'm getting a kickback from Facebook. Sorry, I'm turning off the volume. I'm just trying to keep an eye on Facebook at the same time. We have 10, sorry, Regina, that was the background noise. We do have 10 people joining us, so I'm just watching the comments while you're talking.
Great. Welcome, everyone. So urinary incontinence affects women twice as much as men. So yeah, and this is the most recent study I found is 2012. So yeah, men is not affected as much. So I'm just going to go a little bit of anatomy and the function, physiology, how it all works. So the requirements of continence, it should be intact central and peripheral nervous system, sensory awareness to filling, intact cognitive function, mobility and dexterity. Continence requires bladder to expand and to contract. So when the muscles contracting, they store the urine, and when they're relaxing is when we're passing the urine. So there's 3 layers of muscles in the urethra. Layer 1 and 2 are closing the urethra to hold the urine, and layer 3 supports the bladder to pass the urine. Okay, I have a picture here. So the nervous system that, it's a little technical here, but the S2, S4, it's the spine, the very low spine of the lower back. It's called sacral nerves. So it stands for S. S2 to S4 are the nerves that supply and support that function of holding the urine and passing the urine. Okay. And then thoracic spine, the nerves that go off of that area is sympathetic system, nervous system, which stops the flow. When we finish the urination, that's the nerves that control that. Okay. So this is the picture. And the next slide, I'm going to explain how this all works. So the first picture on top, the bladder fills. So so proper mechanics of voiding. So you sit on the toilet, you have that awareness that you want to pee. Then we need to relax the pelvic floor muscles. The bladder switches on to contract the muscles to start emptying. And then we relax those muscles to really empty completely. So bladder relaxes, pelvic floor muscles and sphincter resume normal resting tone after that. So once we completely relaxed and voided, really past the urine, then the resting tone resumes of the pelvic floor muscles and the bladder muscles. So dysfunctional mechanics of voiding, or the bad habits, JAC, we call it just in case. For example, like someone goes out for a walk and they're afraid that they're gonna have to go pee in the middle of the walk. Just in case they leave the house, before they leave the house, just in case they wanna go and pee. So that's a bad habit. That means that awareness that we have, we wanna pee, we wanna go pee. So this is something that we also treat. Specifically, it's very individualized. If there is such a thing as this bad habit, we do give a lot of different tips. So also a lot of the times when we use public bathrooms, we don't want to sit on a toilet and we kind of semi-squat, not sitting on it. That also doesn't fully empty the bladder. So if you voided, not completely by semi-squatting, then you were gonna want to go to pee again because you didn't fully empty the bladder. Now another one is sometimes we're given such advices when, you know, we want to hold the pee, right? And the muscles get so tired that we just lose that control because we interrupt that voiding. So that's quite a bad habit to have. So, you know, if we have that feeling, that awareness that we need to go, it's time to go. If we hold it long enough, then we might lose that that control. Again, straining and constipation and not being relaxed is also a bad habit and something that is dysfunctional and not a good thing for urination. All right, being dehydrated and not drinking enough, you're avoiding fluids so that you don't have that loss of bladder control or, you know, leakage, is also one of the bad habits. The habitual holding, like for example, if somebody is working long hours and they don't have a chance to go pee, use the bathroom, they just hold their, you know, their urine. And fear of using public toilet, again, we just spoke about it. The cleanliness, privacy, you know, shy bladder syndrome is a social anxiety disorder that makes it difficult or impossible to urinate in public restrooms. Urinary tract infection, it irritates the bladder, causing no strong urge to urinate. And then again, constipation, hard stool in the rectum causes rectal nerves to be overactive. And then that in turn increases the urinary frequency.
I see a quick question here.
Yeah.
I don't interrupt you, but I do want to ask, because you mentioned it. So is it good or bad to hold it? Sometimes they say holding it, you're using your muscle, so it's good. And is it good or bad to hold it in?
So it's not a good thing if you're doing it for a prolonged period of time.
Okay.
Then you're kind of overusing the muscles. They're getting fatigued and tired, and then you just lose it.
Okay.
That's not, in the long term, it's not a good thing.
Okay.
If you're holding it for you know, a few minutes until you get to the bathroom, that's okay. But then if you do it occasionally, that's okay. But if you do that a lot, then your muscles get tired and fatigued as well.
Mm-hmm.
So, you know, to avoid those things, we do have specific exercise programs for people that have those problems. Yeah. So avoiding symptoms. Did that answer your question?
Yes, thank you.
Good. All right. So hesitancy, immediate revoid, post-micturition leak, position dependent. Micturition means when we void, when we go to the bathroom. Dysuria, it's when we're not able to. Slow stream, intermittency, straining, spraying, or incomplete voiding. So those are the symptoms that people with incontinence have. So this is healthy fluid intake. What we're supposed to have is drink half of the body weight, and then in ounces, and that should be 2/3 of, you know, of the water. 2/3 of those fluids should be just clear water. It could be also tea, juices, and all that, but 2/3 supposed to be the water. Timing of the fluids, types of fluids, it matters as well. Exercise, well, breastfeeding is not towards this lecture, but just, you know, for the pregnant or postpartum women. Altitude affects intake as well. Having swollen limbs affects bladder at night. So we need to make sure that that's taken care of as well. You don't want to drink a lot of fluids before bed. Most people are not well hydrated, just in general. And it is recommended to drink more during the day, morning and afternoon, not so much in the evening for older adults, just for those reasons that it just wakes them up a couple of times at night to go.
So can I ask a specific question that someone asked me?
Yeah.
How many hours before bedtime should we stop drinking water? stop drinking, really.
So there are different sources say different things.
I knew that was the answer.
Yeah, so some say 2-3 hours, some say 4 hours. So yeah, but you know, a little sip here and there before sleep, which you just to get that urge to drink, that thirst that you have to relieve that, that's fine.
Mhm.
Unless, you know, if you're sitting with a teapot and drinking like a caffeinated tea, then that's a problem, you know.
Yeah.
But yeah, a sip here and there is fine.
Okay, thank you. People always ask me that.
Okay, so foods that are bladder irritant, and a lot of them are, you know, you would be surprised that they do that. Citrusy juices and fruits, tomatoes, spicy foods, sweets, chocolate, dairy products, and milk, artificial sweeteners. These are the main things that we eat, right? The alcohol is also irritant. Beer or wine, carbonated drinks, caffeine we mentioned already, coffee, tea, decaf as well is, you know, the irritant. So if people, like in our case here, we have people that go at night and really have the urge at night. So make sure that this is not consumed before bedtime, at least I would say up to 3 hours before bedtime. Okay.
Well, I just learned something new, Regina. I didn't know this. So what does that mean? What does that mean, irritant? It means like if I eat sweets or chocolates, it's going to make me go to the bathroom more? Is that what it's saying?
Yes.
I didn't know that. I learned something new today.
Yes. So it irritates the muscle to void, basically.
Wow.
It relaxes the muscle, and then, you know, the urge comes. Yeah, that's interesting.
Really interesting.
Typical patterns, the voiding that we're supposed to have within 24 hours is between 5 to 8 times. Intervals should be every like 2 to 4 hours. And then 0 to 1 voids after bedtime, and no necessarily having just in case avoiding. So, okay. So there are different types of urinary incontinence. First one, the most common one is stress incontinence. It's when urine leaks when you exert pressure on your bladder with coughing, sneezing, laughing, if you're exercising or lifting something heavy, or just like lifting a box at home. That's something that's called stress incontinence. The urge incontinence is the other one that it causes a sudden and intense urge to urinate, and that's like so sudden that people are not able to make it in time to the bathroom. You may need to urinate often, including throughout the night. The urge incontinence may be caused by minor conditions such as an infection, like urinary tract infection, more severe conditions like neurological conditions like multiple sclerosis, Parkinson's disease, diabetes. Those are the diseases that cause the urge incontinence.
Regina, there's a question here, which you might say you'll get to soon, but I'm just going to throw it out now. Someone wrote, what can you do if you find yourself going 4 to 6 times during sleep? Whoa, that's a lot.
Right, so that's urge incontinence. So with physical therapy, we have specific exercises to work on those muscles of the bladder and the pelvic floor. It depends if there's something else going on. If you're on medications, that is a side effect of, you know, of incontinence. So we look at a lot of different things to determine what exactly could be the treatment. But if it is a cause, which is a common cause of muscle weakness, and you're not able to hold the urine in your bladder, there are a lot of strengthening exercises that we prescribe to patients.
Okay, thank you.
Sure. So other types of incontinence is overflow, which is when you experience a frequent or constant dribbling of urine due to bladder that doesn't empty completely. So I work with a lot of women where they say they feel like they passed the whole thing fully, completely, and then when they get up from the toilet, there's still dribbling going. So that's overflow incontinence. Functional incontinence is a physical or mental impairment keeps you from making it to the toilet in time. For example, if you have like severe arthritis, you're in pain, or with Parkinson's, you're slow to walk to the bathroom, or unbuttoning the pants or pulling the pants down, you're just not making it quick enough to the bathroom. So that's called functional. And then mixed is when you experience more than one type of urinary incontinence at once. And that refers to combination of stress and urge incontinence. So when do we need to see the doctor? Many women do not want to talk about this. They seem to have to think that it's personal, they're embarrassed. It's a common medical problem and many have been treated successfully. A lot of women feel like, oh, okay, I'm getting older, I'm taking these medications, but still it's worth getting that evaluation and examining where is it stemming from. Is it really the medication? Is it really your functional inability to hold the urine, which is when we see us as physical therapists? And if it is something that's functional and we can treat it, and people get that quality of life, it's just amazing how lives change when we take care of it. Your doctor might not treat these problems, but like a specialist, like urologists, gynecologists, urogynecologists, doctors, they do certain tests to really see and pinpoint where the problem is stemming from. So, and I always say that if the person is healthy, but this is just the problem that is bothering them, in New York City, in New York State, people are able to go to physical therapists straight without a referral. A lot of the times you wait for the doctor's appointment 2 weeks, if not more, and the problem persists and they're just not able to control it anymore. We have patients that go straight to see us without a doctor's referral. And we are trained to really see if there's something serious going on, we right away refer them back to the doctor to really assess other things that are going on. So, it's good to have both options available. And then, when you see either the doctor or physical therapist, it's good to keep a diary and writing down like when you leak the urine, at which point, and making sure to note what you were doing at that time. Was it sneezing, coughing, laughing, or lifting, or during sleep? You didn't make it to the bathroom. So that's something that will tell us what type of incontinence it is. That would be, really helpful to either us or the doctor. So these are the type of treatments. And the first is the behavioral treatment, is something that we take care of as physical therapists. Medicine, some devices, nerve stimulation, biofeedback, and then surgery. I would always say, use it as a last resort. Try all the conservative treatments before really considering the surgery. A lot of people think it's a quick fix, and a lot of the times it's not. So it's a really supposed to be careful consideration before we go and consider surgery. And then catheterization as well is one of the options, but this is all like medical procedures that we don't do. But I just listed so that just to show you that this is an option. So behavioral treatment, by changing some basic behaviors, we may be able to improve the incontinence. And one of the first things and important exercise and procedure is the Kegel exercise, where we strengthen the bladder and pelvic muscles. So exercising the pelvic floor muscles regularly can reduce or even cure the stress leakage. A doctor or a nurse can also teach those, and you know, you can have those available online as well. But make sure, I would strongly suggest having a healthcare professional teach you those, because there are different ways of doing these exercises depending on what and how severe the problem is. So that's something that you know, if we're not doing those properly, then it can worsen the problem. And then the people say, oh, Kegels didn't help me. And then they consider other options. And in the end, they consider the surgery, which again, I'm not discouraging people, but it should be as the last resort. Really, having been taught these exercises properly is important to really see a good effect of them. So we want to first practice these exercises by laying down. We want to squeeze the muscles of the, as if we want to stop the urine. We want to squeeze the muscles, hold it. Sometimes we repeat it 10 times quickly. We sometimes repeat it just 10 times, as much as strength that we can give, and really squeeze as if we want to hold the urine, okay? Or trying to stop the passing the gas, right? It's all the rectum and the urethra is close together. So we wanna, once we squeeze, we're gonna squeeze both, as if we wanna slow the urine, right? Stop the urination or stop the passing of the gas. So we usually give a prescription of doing 10 repetitions, 3 sets of 10, throughout a day, maybe like 4 times a day, doing those 3 sets of 10. And then if you're able to hold it for about 3 seconds each squeeze, that's even better. That means that if you're able to tolerate it, you're getting stronger, okay? So every time you squeeze, you need to completely relax when you're done with the squeeze. So being able to completely relax is important as well. But if you squeeze and then squeeze again up to 10 times, and you're not fully relaxing, that means that you're not, some people are not able to go up to 10 repetitions because they're getting so fatigued in those muscles. So it's very important to relax completely after each repetition. What else? And then once we get used to doing those exercises, we first start laying down, then we can do it standing or sitting at any point of, you know, daily activities. And only doing like 3 sets of 10, which is 30 repetitions, it's not gonna take a long time. A lot of people say, oh, I just don't have time, and they don't get it into their routine. And, you know, just getting it little by little. If you're not doing 3 sets of 10, that's fine as well. But then getting used to it, you're gonna get another set and another set of 10 to make it up to 3 sets of 10. Yeah, so basically doing it correctly is very important, and instruction from a healthcare professional is crucial. So simply trying to stop your urine flow or trying to do the exercise without that instruction is just not going to be beneficial or helpful. And in some cases, it doesn't do anything at all if it's not properly instructed. So bladder retraining. You may regain bladder control by going to the bathroom at a set times, so you can kind of time yourself before you get the urge to urinate. And you can slowly increase that time between the bathroom trips to gain that control. Weight loss is also beneficial, and something that I personally train people for weight loss as well through different programs, exercise programs. And because that extra weight puts pressure on the bladder and or nearby muscles to cause that incontinence. So this can cause, bladder problems like we spoke before. So, working with someone on a diet or exercise program, if you're overweight, to relieve that incontinence is going to be helpful and one of the treatments. Dietary changes. So like we spoke before, some foods and beverages are thought to contribute to leakage. So while doctors don't know if these foods are really do cause the incontinence, it is reasonable to really see and stop and do a process of elimination of those diets or products, what we listed before, like carbonated beverages, coffee or tea, and to see whether that changes in your case, the urinary incontinence. So other changes include drinking fewer fluids after dinner and eating enough fiber to avoid constipation. So those are dietary changes that are important to address those issues. Avoid drinking too much, 6 to 8 ounces, 6 cups or to 8 cups of 8-ounce glass of fluid a day is enough for most people. A lot of people need more, some people need less. But like we spoke before, 3 to 4 hours before bedtime, I would say to just sip the water, but not having like a full cup before you go to sleep. Smoking is also one of the treatments. I mean, that's not something we do, but it is a behavioral treatment. And there's, researchers are still looking at this link between incontinence and smoking. And there's some studies that show that more frequent and severe urine leaks in those that are smokers. So prevention, maintaining healthy weight, practicing the pelvic floor exercises that we just spoke, avoiding bladder irritants such as caffeine, alcohol, acidic foods, eating more fiber that can prevent constipation, and then quitting smoking or seeking help to quit smoking. That's pretty much it. I hope that was informative and educational. If you have any questions, are we ready to take some?
Amazing. That was super informative. I did not know all that. I just learned a lot of new stuff. If anyone has any questions or comments, put them in the chat, in the comments on Facebook. I'm watching it. We'll take any questions now. But Regina, that was so interesting and so helpful in so many ways. And I guess I'm curious about the medicines that the doctors give for incontinence. Like, does it help the meds?
Yeah.
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 When do they give that? Like, what are the meds for, really?
So they test first. They do test the ultrasound. They test the bladder function, along with the diary. The patients write down at which point that they lose that flow and control of the flow, and then they just see what type of medicine they need. I'm really not familiar very much with the medicine because we don't really prescribe or deal with it. So
right, yeah, I was just curious. I've heard there are medicines for incontinence, but I also don't know so much about that. I was just curious. Okay, someone had a question here. I missed what you said about just in case. Okay, the just in case thing. Do you want to repeat that?
So, yeah. So, for example, I hear a lot of cases where women say, "Oh, before I leave the house, I gotta pee." If, for example, you're going to be out for a while, like you're going shopping or I don't know, a trip you're taking, and you know that there's not going to be a bathroom nearby, just in case means that you're going to just in case go to the bathroom before you leave the house. That's what it is.
Okay, someone else asked, can you talk a little more about how cognition plays into this and how to help women with dementia address incontinence?
So is that the whole question?
Yeah. It says, can you talk a little more about how cognition plays into this and how to help women with dementia address incontinence? Yeah, that gets complicated, right? Because people with dementia sometimes lose the control and then
Yes.
they also get confused. They don't really know what's happening, right?
Right, exactly. So what we do in those cases, just like I said earlier, with age, we lose that control, we lose that muscle strength and muscle mass of the bladder. So whether your cognitive level is okay or you have dementia, it's inevitable and it happens. So people with dementia, what we do, if we know that there's incontinence, we do give those exercises that they train their bladder with the exercises, and eventually they have that control better.
Mhm.
And so, you know, even though they have that dementia, they start having that control, the bladder control. So they're able to go when they need to go.
Okay, good. So that's helpful that even if someone has dementia, they could still do these exercises and it could still help.
Right. But to do those exercises, if they're forgetful,
You have to do with them.
the family member or
Yeah.
the caretaker that's with them should advise, okay, this is time. We need to do it now.
Yeah.
3 sets of 10 or directing them, basically.
Yeah.
Reminding them.
Yeah. Okay. Thank you. That's helpful. Okay. The person who asked about the just in case, so you answered her, but she just asked another question. So is just in case good or does it cause a habit? So I think you were saying that it's a bad habit, right?
Right. It's a bad habit. So because you don't have that urge, you don't really need to go.
Right.
You're kind of making you're training your muscles to go. So I mean, it's not a good thing. You would want to go when you need to go, when you're
Right.
cognitively want to go.
Mm-hmm. Mm-hmm. Okay, Regina, and we have a couple thank yous, and it was very informative and well presented. So now Regina actually has a really nice offer. She wants to tell you how you can reach her if you have more questions, and she just wants to say a little bit about what she offers. So stay on for a couple more minutes. We're almost done.
So if you really think that you need a physical therapy treatment, consult with your doctor, consult with a physical therapist. If you're in New York area, you can definitely contact me through my website, www.mobilecarept.com. It's on the next page here.
I'm also going to put it in the Facebook chat right now, www.mobilept.com.
MobileCarePT.
MobileCare. There it is, mobilecarept.com.
Yes. So if you're in New York area, I offer in-person or virtual visits. If you're in another state or Israel, you should definitely contact a healthcare professional that's in your state, in your area. But for a wellness program, I do offer a discount for group members, and I do virtual classes customized to your problems and women's health issues. If it's not incontinence, that's fine too. Any women's health issues. So 10 classes would be twice a week for 6 weeks, and that would be $200. So if you're interested, definitely sign up. Contact me again through my website, www.mobilecarept.com, and we'll start taking care of this problem and get back to your quality of life.
Wow. Thank you so much, Regina. I really, really appreciate your expertise, your time, and you're helping us with this issue that really people don't talk about, but that's was so helpful. Thank you. Any other questions? If anybody has any other questions or comments, feel free to put them in the chat. I'm watching the chat, and we still have 8 people on with us, so that's amazing. And I'm going to take 1 minute to promote one of my classes for those of you that don't know about Remembership. Regina, leave your email and website up there so people can write it down. And I also put it in the chat, in the comments. I just want to talk about Remembership for 1 minute. I have a 3-month program called Remembership, and it's something you do on your own. You get a video a week, a brain exercise a week, and it's short and easy and cheap. It's really convenient. People are loving it. I've had dozens of people go through it. So every week you get a short video about memory tips and techniques, brain exercise, and then once a month we hop on a group coaching call where I will answer your questions about any of the information in the videos, and you get to meet the other members. It's called Remembership, and you can also go to my website. Actually, I'm going to put the link to it also in the chat, and you can check out all the details. And you can join at any time, and it's fun and helpful. Remembership, it's called. It's ReneaKuski.com/remembership. Okay, I'm putting it in the chat. So if that sounds interesting to you, feel free to check that out. And, I just want to say what I said in the beginning, which is at first I was thinking, like, what's the connection between memory and incontinence? And I realized that, first of all, it was the connection that we talked about before with dementia and incontinence. And also, people complain often that they don't sleep well because they're getting up to go to the bathroom. And one of the main curable causes of memory loss is lack of sleep or sleep apnea. So if we can get the sleep, our sleep situation better, improve our sleep situation, guess what? Our memory and our cognition is going to improve, right? So that's an amazing connection. And I'm really grateful to Regina for reaching out and pushing this. At first I said, no, there's no connection, but then I realized there is, and Regina had a lot of good information to share, and I really, really thank you for that. And thank you everyone for joining. Regina, any last comments you want to say?
No, I hope everyone is well, and don't be shy to speak up about these problems. And although it's common, it is not normal. Get help, and the help is out there.
Amazing. Amazing. Thank you so much, Regina.
Pleasure.
Good day. If you're in New York, I guess it's good day. I'm in Israel, so good night. Take care, everyone. Stay healthy and well. And thank you for joining us.